Hello and welcome to COVID Conversations here on WNCU 90.7 FM, streaming on YouTube, Facebook, and Instagram. I'm your host, Kimberley Cartwright, News and Public Affairs Director here at WNCU. And we're using the Zoom platform to talk about how COVID-19 is affecting our world. This program is made possible by Duke University's School of Medicine and the Clinical and Translational Science Institute, the African American COVID Task Force Plus of Durham, and the Save a Life campaign presented by the Corporation for Public Broadcasting, KTF, and WNCU 90.7 FM. Now, since the advent of modern medicine, virologists contributed to innovations in healthcare and developing vaccines for multiple diseases to sequencing DNA. And here to talk about what virology means in the fight against COVID-19 is Dr. Richard Watson. He is the CEO of the Science Policy Action Network. Hello and welcome, Dr. Watkins.
Hello. Thank you so much for having me. I'm so glad to be here. And it's really good to be talking about virology. It's not something that you think about all the time, but when you find yourself in the midst of a pandemic, you find yourself thinking about, who does this? Who studies this, right? Who is going to figure this out? And those are virologists. And that's what I am, a scientist that studies viruses. You have scientists that study a wide variety of things, right? You have scientists that study the space. You have science that has principles about plants and chemistry and so on and so forth. And I happen to be one that studies viruses. The virus that I did most of my work on in graduate school, earning my PhD, was human immunodeficiency virus, or HIV. And we were working really hard to uncover the factors of HIV that lead to disease progression and ultimately development of AIDS in HIV positive patients. And so I'm very, very excited to be here to, tell your viewers all about virology and dig into this coronavirus a little bit more.
Oh my goodness, thank you so much. I appreciate your time. And virology was definitely a new word for me. I had no clue that people like you existed, but we're certainly glad that you are. First question is, COVID-19 is referred to as the novel virus. Can you tell us what that means and what impact it has on the effect of the disease on humans and the vaccines that are being developed to fight it?
Yeah, well, all, novel means is new, right? You haven't seen it before. And you can kind of think about, doing battle with these viruses as, taking a test, right? You don't want to go into an exam. All about exams and how your students may get frustrated if on an exam they see questions or information that's new to them. Right, wait, we didn't prepare for this, right? And so kind of that new material for them being on an exam is problematic. And their likelihood of performing well on that exam has a lot to do with how much new material is on that exam, right? On the other end, contrary to that situation, is a student that's taking an exam that they prepared for. All the material on the exam is something that they have seen, something that they have rehearsed, practiced, studied for, went over. They're going to do better on that exam. That is the exact same thing with viruses or any pathogen. And pathogens are just little small things that get into your body and hurt you. Those are pathogens, right? Your body, its likelihood of performing well depends heavily on whether or not it's seen it before, whether it's seen the material before. If it hasn't, in the case of novel viruses, there's a tendency for the body not to perform well. And that's really the problem with novel viruses. Our immune system is created so that it learns, it develops, it adapts, it protects. But the critical piece is learning, and it's got to see the material. So novel viruses are a huge concern. They have been a concern throughout the history of humanity, and they will continue to be a concern.
I want you to talk to me specifically about how the coronavirus affects the body. So I'm here in my office and somebody else has been in my office. Maybe they sneezed on my computer, or maybe I'm in an office where I have a microphone. Maybe they came and spoke on my microphone. So then how is it that I would catch the coronavirus? What happens?
Yeah, well, I think a bridge from that first question to this question would to be to kind of go to some terminology here. It gets really confusing because I don't think many outlets do what you're doing and giving people an opportunity to kind of dive deep into these questions. And so you've got COVID-19, which is coronavirus disease 2019, right? But the virus that causes that disease is SARS-CoV-2, or severe acute respiratory syndrome coronavirus number 2. And so you can get infected with the virus and not necessarily develop the disease. So that's a difference. So when people say, hey, I got a test, I tested positive for COVID, but I feel fine, right? They didn't necessarily test positive for COVID. They test positive for the presence of the virus that sometimes causes COVID. So that's just a little nomenclature that I want to kind of clear up, because it causes a bit of confusion when somebody says, man, I got the vaccine and I still got COVID. I'm like, did you go to the hospital? Did you get sick? No, I didn't get sick. Well, I mean, you didn't have COVID. You were infected with the virus, but you didn't develop the disease. So count your lucky stars and, count your blessings appropriately. But when one is infected and the virus is replicating, and viruses don't replicate on their own, right? They require a host to make more of themselves. And so think about the little image of the virus that you've seen as a representation of SARS-CoV-2. It by itself cannot split into 2 and 2 split into 4 and so on and so forth, right? It can't do that by itself. What it requires is a host cell. The cell could be any number of cells in your body, right? From the cells that make your lungs, from the cells that make your skin, all of these cells are capable of being infected by one virus or another, right? And so the virus gets into the cell, and then you do all the work for the virus, right? And then you start making more virus, more virus, more virus, more virus. And your cell basically, in a lot of cases, stops doing what it's supposed to do and transforms into a factory of making more virus. So the virus uses all the machinery. It kicks all the cooks out of the kitchen and just says, I'm taking over, I'm making what I want to make, and it starts making more of itself. And so that's what happens. And so more virus starts to build up in your body. And when you just breathe, you go outside on a cold, cold morning, one of the first things you recognize if you go out to pull the trash cans up is the smoke coming out of your mouth, right? That kind of fog that you breathe out on a cold morning, those are tiny, tiny droplets that are coming out of your mouth. When it's hot, you wouldn't see them, but because it's cold, you can see it, right? And those little droplets contain all sorts of stuff. You breathe on people all the time. And that breath always contains something. More often than not, it contains some bacteria. More often than not, it contains some virus. It definitely contains spit, right? So that's what these droplets are, right? Because your immune system is equipped to deal with a wide variety of things, people breathing on you is not a problem. But for somebody infected with SARS-CoV-2, those droplets can contain the virus. And when you come into contact with those droplets, whether you inhale it or the droplets fall onto a surface, you touch the surface, then you touch an opening of your body, your mouth, your nose, your eyes, that can be a route of infection. And so that's just how the virus spreads from one person to another. Either you breathe what they are exhaling, you inhale what they exhale, you pick it up that way, or you can touch a wide variety of things which the virus has come into contact with, because it has come into contact with droplets from somebody sneezing, coughing, talking, or just breathing. So it's not just like sneezing or coughing that you have to be kind of thinking about. It's just close contact with people. So
I've never heard it in that way, in that simplistic way. So I'm doing all the, when do I start to fight the virus and get well if I have it?
you start fighting the virus immediately, right? And that's what makes this really, really bad, right? Because I've always had a hypothesis that if the virus doesn't have to make you sick in order to spread from one person to another, then it's an unintended consequence that you get sick. You know, most people who are infected with SARS-CoV-2 have mild to no symptoms, which makes the perfect vessel to infect other people, right? Because sick people do very, very good things to keep other people from getting sick. The biggest one is they look sick. When someone looks sick, the first thing that people do that sees this person looking sick is they stay away. Like you've evolved to want to stay away from sick people, because our ancestors, they figured out a long time ago that if you're around a sick person and close to a sick person, it increases the likelihood that you yourself will get sick. And so when somebody looks sick, other people stay away. Second, when you are sick, you tend not to want to go around and be around other people. When you are sick, you want to just be in your house and be in your home. You're not going to feel like going to the mall. You're not necessarily going to feel like going to a basketball game. You don't feel good. And so you generally kind of stay away, stay home as you heal. Conversely, if you are infected and you feel right as rain, you do all of the things that a healthy person would do. Other healthy people come close to you. You go to basketball games, you feel well, you go to school, you go to work. And that is the perfect opportunity for the virus to jump into somebody else. And so that's why this stuff is so problematic, as people walk around because they don't feel bad, but they still could be infected and producing virus that then can go on and affect other people. But your body begins to fight this virus immediately.
So how do boosters work then? So if you go out and you get the shot. So I had my shot like early in the year, and then I went back to get a booster. So how does that work? And then who should get a booster shot?
Yeah, so I like to think about it. Let's go back to our kind of academic analogy, right? Like studying for tests, right? These vaccines, they're just study guides, right? They're just study guides, right? And they're just like refreshers, right? You get the study guide. The second shot, which is technically a booster, is kind of a refresher course, right? And the third shot, which is also another booster, is another refresher course. Because, I mean, the education of your immune system is critical. And over time, with certain pathogens, your immune system tends to forget the lessons that it was taught. And so the booster is kind of like a refresher course. Like, hey, class, I know it's been a long time since we covered chapter 1 and chapter 2, now that we're on chapter 67. But some of the material that we learned in chapter 1 or 2 is going to be very critical to understanding the next chapters that we're going to go over. So we're going to go do a refresher. And in your whole class, they realize how much they have forgotten from all the way at the beginning of the semester. That's kind of like how your immune system is. Once you kind of get to 6 months, right, your immune system begins to forget a little bit of the lessons that it was taught. And that booster shot is kind of like a refresher course, and it gets your immune system back to kind of working in tip-top shape, ready to take the exam, ready to see the virus and ready to really do battle. And so it all is really kind of like a game of this kind of education of your immune system, which in the case of vaccines produces antibodies. And those antibodies are very, very critical to getting rid of viruses.
Thank you so much for making us a little bit smarter. You did not forget of your assignments and in your course of study. This was really, really good. I've never heard it put this way. And it sounds like it's really easier for people to understand what we're up against and then, how we should go and take care of ourselves. So I appreciate that. And I heard too, before we run out of time, is that you're running for U.S. Congress in the 6th district, covering Durham, Wake County, and Orange County. And how's that going?
Oh, it's going wonderful. But, like the pandemic, things are complicated. And so I encourage each and every one of your viewers to stay abreast of everything that's going on. Stay tuned into your local news. It'll tell you all about polling stations. It'll tell you all about when primaries are. As things move around, my advice as a person who is committed to public service is just stay informed, whether it's the pandemic or politics or anything in between. Tune in to shows just like this, radio, news, or follow any of the amazing researchers at North Carolina Central University or at other universities around the state to stay informed.
You have been an amazing guest. Thank you, Dr. Richard Watkins, for being on the show with me today.
Oh, you're very welcome. Thank you so much for having me.
Yes, and thank you, audience, for watching via YouTube, Facebook, and Instagram, as well as listening on WNCU 90.7 FM. Be sure to like us. We want you to follow us, and we want you to subscribe to our pages to see more of our archived shows. I'm Kimberley Pierce Cartwright, your host for COVID Conversations, and we want to thank Duke University School of Medicine and the Clinical and Translational Science Institute, the African American COVID Task Force Plus of Durham, and the Save a Life campaign presented by the Corporation for Public Broadcasting, KTSU, and of course, WNCU 90.7 FM. Again, thank you so much for tuning in.